I'm going to talk about aphasia and the types of aphasia. Aphasia is the loss of ability to understand speech or communicate using language. It can occur when areas of brain responsible for language become damaged. There are several different types of aphasia. Each type is categorized as either fluent or non-fluent. Broca's aphasia is a non-fluent type. Broca's aphasia results from damage to part of the brain called Broca's area, which is located in the front lobe, usually on the left side. It's one of the parts of the brain responsible for speech and for motor movement. It's named for Pierre-Paul Broca, a French physician who discovered the area in 1861. Broca's aphasia is also referred to as expressive aphasia. The symptoms are, if you have Broca's aphasia, you may be able to comprehend what is being said, but be unable to speak fluently because your brain is having trouble communicating efficiently to all the muscles needed to form words. They may create great frustration, since you know what you want to say but can't get the words out the way you wish to. Symptoms of Broca's aphasia include poor or absent grammar, difficulty forming complete sentences, omitting certain words such as the, and, as, is. Broca's aphasia may say something like cup, me, instead of I want the cup. More difficulty using verbs than nouns correctly. Difficulty articulating sounds and words. Difficulty repeating what has been said by others. Trouble with writing sentences. Difficulty reading. Problems with full comprehension. Difficulty following direction. Frustration. The causes are anything that causes the death of brain cells may result in aphasia. Brain cells die when blood flow or oxygen flow to a particular part of the brain is stopped or diminished. Causes include stroke, brain tumor, injury to brain such as form and severe blow to the head or gunshot wound, infection in the brain, progressive neurological conditions such as Alzheimer's disease. Diagnosis of aphasia. Diagnosis. If a stroke or other form of brain injury occurs, a doctor will test for the symptoms of aphasia. If you are someone with a progressive neurological condition, being to show trouble with speaking or language comprehension, a medical evaluation should be sought immediately. The doctor will talk to you to determine your ability to comprehend and communicate. If problems with speech or comprehension are apparent or suspected, addition testing will be done. Diagnosis of Broca's aphasia requires an MRI or CT scan. This test helps determine the exact area of brain that's affected, as well as the extent of the damage. Now we are going to see about the treatment of aphasia. Broca's aphasia may improve even without treatment. Working with a speech-language pathologist, both in person or online, can greatly enhance this progress. The more practice someone has speaking in a safe environment, the more likely they may be to continue trying to improve. Finding a support group, book club or another type of social settings with other people going through the same thing can be very beneficial. If you care about someone who has this condition, remember that they are just as intelligent as before. Be understanding as they may feel frustration about their current situation. They have patience, and to include them in the life of your family or circle of friends. Keep them in the loop by including them actively in concerns and by looking directly at them rather than talking around them. Other tips for communicating include keep your sentences simple and short, but don't speak them as if they are a child. Remember that their interests have not changed, only their ability to talk about them. Ask lots of yes and no questions or questions that require very simple answers. Use gestures or props to get your point across. Hold in simple interactions such as sitting quietly in nature, where you can enjoy each other's presence without speaking too much. If you have Broca's aphasia, you can help to accelerate your own progress by having verbal interaction with people you trust. There are other techniques you can use. Try to control the noise level of the room you are in before you are attending events. This may help to build up your confidence level. Keep trying. Remember that improvement can contribute for many years. Go at your own pace. Just make sure to keep going. Aphasia. Other types of aphasia include Wernicke's aphasia, global aphasia, conduction aphasia, and anatomic aphasia. All types of aphasia affect communication and speech. Wernicke's aphasia. Wernicke's aphasia affects. Now we are going to see about Wernicke's aphasia. Wernicke's aphasia affects the area of the brain known as Wernicke's area, which is located on the left middle side. People with this condition have difficulty with language comprehension and may have a harder time processing spoken words than those with Broca's aphasia do. People with Wernicke's aphasia also disparately a different type of speech pattern. Wernicke's is a type of fluent aphasia. Symptoms include articulating sentences that have the appropriate candidate but lack the right words, jumbling words together in a seemingly arbitrary sequence, inserting made-up nonsense like words into sentences, being unaware that you may be articulating something incomprehensible to others. Now we are going to see about the prevention of aphasias. There is no one method for preventing Broca's aphasia or any other types of aphasia. One way to try to prevent it is by reducing your risk of having a stroke. This may require lifestyle changes such as smoking, cessation, lowering your cholesterol consumption, and losing weight. Medication that lower blood pressure and cholesterol can also help. Talk to your doctor about your stroke risk and about life cycles changes you can make to reduce it. It's also important to safeguard your head during sports and other activities such as riding a motorcycle. Wearing a helmet can help to prevent these types of brain injuries that can lead to aphasia. Thank you, and that's about aphasias and types of aphasia.